Alright, I'm going to talk about surgeries in arm wrestling. A lot of people are right there. They're on the verge of getting surgery as arm wrestlers. Before we before we start, I want to be clear that there's a difference between trying to be healthy and trying to be a competitive athlete. I think if you really have ambitions of being any kind of an elite level competitive athlete, you have to, at some point, expect a surgery in your career. But that is not the end of the road for anybody. I mean, you look at most top elite guys in our profession, and most of them have a surgery or two along the way. My surgery count is two right hand elbow surgeries. You can maybe see the scars there. I don't know. Oh, there you go. Yeah, so two right hands and one left. The right hands, uh, I probably waited too long to get the surgery, and the left hand, I think I hit it right on the mark. So, in our sport, arm wrestling, there's probably two main types of surgeries. There's the one to fix an acute problem, like you're pulling Dave Chafee and bam, you get your bicep ripped off, or you know, you're at the WOW finals and you blow your shoulder or something. Not a lot of questions on what really has to happen. That's a reattachment issue. Just tell the doctor, yeah, reattach that thing just a little bit lower for me, please, so I get that extra gear. Um, but the more common one that arm wrestlers struggle with is the chronic injury, the build-up injury, and arm wrestlers get it mostly in three places: wrist, elbow, shoulder. And I'm gonna say that for like 90% of the population arm wrestlers, you're getting it in your elbow. Okay, you get a chronic build-up. It goes from one spot to the other to the other. You'll start. You'll get symptoms leading up to a point of no return. Like you'll start to lose range of motion. You will start to experience increase in hand deadness, so like falling asleep, numbness, uh, especially brought on after hard practices or hard training. Just because you're going to build up scar tissue, you're going to build up bone chips, whatever in that elbow joint. It's doing two things. One thing it's doing is it's your body's it's your body's adaptation, right, to arm wrestling. Stabilize that joint, lay down stuff to protect itself, especially if you're a grinder, okay? Especially if you pull when you probably shouldn't, when you should let that match go if you're the guy who doesn't. If you're a grinder, you're probably gonna accelerate your destiny, okay? Which is not a bad thing. It's whatever you want to do. But anyways, so that's one of the symptoms. The thing you got to think is your arm is never ever going to be perfect. It's never ever perfect. As a competitive athlete, you are really just trying to keep your boat afloat, going to your destination. Okay, so if you can patch up that boat, keep it sailing, and you can see where you're going, and you think you're going to get there, don't get surgery. Don't get surgery. But if that boat is sinking and there's nothing you can do to even keep it afloat, then that's your sign. What were the signs for me when it comes to elbow joint surgery? Is performance. That's really what it comes down. People say, "Oh, I've got pain, I've got reduced motion, I've got pins and needles." That's all fine. You can work with all that stuff, but when your performance starts to drop and there's nothing you can do about it, that was my indicator. The reason why my performance was dropping was an my body was unable to push fluids properly through this region. Just too tight. Just too much junk. My veins were being constricted. My arteries were being constricted. And my arm wasn't able to feed itself. The other thing that I knew was the nerve supply was being limited. Okay, same reason. Just I think the overall pressure. So I wasn't able to fire as hard. Most guys start to notice the top row first. Okay, your ability to pronate is often the first thing to go. So that's when I knew it was time. Okay, so you make the decision. You're both sinking, and you got to find a doctor. You got to find that doctor. This phone, I can't get it to stay in one place. There we go. You got to find a doctor. You got to find a good doctor. You don't want it to be their maiden voyage, right? You don't want it to be their first time doing an elbow surgery. And preferably, if they've seen an arm wrestler before, that's even an advantage. Dr. Jay Pollock was the guy who, saved my career here in Ottawa. He did all of mine, so 2 and 1. And I know that he's actually fixed a lot of broken arm wrestlers before, so I was really happy to get to see him. Explain to your doctor what you want to do in the future. Tell him about arm wrestling. Tell him that you intend to arm wrestle later, because that's going to influence the way that they do the surgery. They may leave a little bit more here or there. Explain to them about the pronation, the ability to get tight to your arm. I think these are just things that are going to help them as surgeons. They're really smart people. You tell them a little bit about arm wrestling, they're going to probably give you a more tailored surgery. So you get the surgery done. You got a couple weeks there where just the main concern is not busting those stitches open. You do not want an elbow infection. That will set you back years, I think. If you get an elbow infection, that's going to be terrible. So let the skin heal up, but be moving it as soon as you can. As soon as you can, start moving. You want that scar tissue to lay down in a logical fashion. It'll be stronger. And then comes the slow road. Right away when you get surgery, you're going to feel totally different. Okay? The first thing is you're going to have no stability. Zero. For arm wrestling, what's going to happen is all those ligaments that, are holding your joint together, they've been used to going around a ball that's like this big, and now the ball is this big. So they're still all stretched out. And so you're going to have a loose and sloppy elbow joint. But you're going to have amazing blood flow right away. And you're going to have awesome nerve supply, especially if they move your nerve at all or do anything with that, which they should do. So right away, you are going to be on the uphill slope from this place that you've gone. It's going to be low. There's going to be a mindset shift that you're going to have to take. One of the things is, we talk about being perfect. Don't expect the surgery to be perfect. Okay? It's not a magic fix. Right away, you may have questions if you did the right thing. There still may be some of your symptoms from before. You may have clicking. You may have pain. But you're now able to build. And you talk to most guys who have this done, and most will tell you a very similar story. And you're looking at about a 3.5 to 4 year journey to get to be a proficient arm wrestler again. Okay? Within the first few months, you will start to be comfortable with putting your arm on the table again. And you might develop a spot, or maybe two. And they likely won't be connected. So what that might look like is you might have a one spot of strength, way outside, non-shoulder committed. This is a normal spot for guys who get the surgery. Way out, no side, just a little bit of up and a little bit of twist out, a little bit of cup. And then you might get a spot that's way in pushing, but no side. It's just if you can push on a guy, there's something there. And then, so you got a spot out and a spot in, and then it's that long journey to bring them together till they finally meet. And that may take 3 to 4 years of work. But you'll be a different arm wrestler at the end of it, because you're being trained by a guy who's already done the journey. So it can be a lot of fun. And the surgery, uh, if you really love arm wrestling and you want to keep going, sometimes surgery is the answer. Um, just think it will take a lot of work. Okay, if you're gonna get the surgery and you want to return to arm wrestling, it will take a lot of reps, and you have to treat your workouts in your injured arm like warm-ups. You have to do warm-ups every day. You have to do like 3 or 4 warm-ups just to pump nutrition and fluid through the damaged area, lay down the scar tissue in the way that you want it to grow back. And your joint will rebuild to a point where, I don't know, maybe you're ready to chase a world title again, That's right. That's right. Anyways, good luck to all you guys. It's not the end. It's just a beginning and an extension of contract.